I would like to share with you a couple of bar graphs that represent infection rate by population density and really comparison between urban counties and some rural counties. In the wake of the recent meatpacking outbreak, COVID-19 outbreaks that we're noticing happen, that have been confirmed by the North Carolina Department of Health and Human Services. We have a graph here of it's the infection rate per 100,000. And what we've done, we've taken the state overall rate of 229 per 100,000. Then we've split it up here. We've taken a look at the rural counties and the urban suburban counties, and we're using the rural center methodology here, where I think 8 to about 10 counties that are classified as urban and suburban versus the rest of the counties that are considered rural. We see that the rural counties have a higher rate than urban counties, relatively speaking. And so a lot of the coverage focuses on the sheer number of infections in places like Wake and Mecklenburg, and we don't really take a hard look at how that's affecting rural North Carolina. So we're going to go forward here and take a look at two, again, of the highlighted counties that we hear about often, Wake and Mecklenburg. But when you take a look at Duplin and Wayne, you see that the case rate in comparison is pretty stark. It's much different and much higher in these two rural counties that are in sort of a nexus point of meatpacking spaces. We'll go to death rate here, and we see Northampton and Vance lead the state with 62 deaths per 100,000 in Northampton, and in Vance 40 deaths per 100,000. Okay, we can compare that to Wake and Mecklenburg. Again, Wake and Mecklenburg really dominate headlines with regard to case rate numbers, but that doesn't tell the full story. What we see here is a much starker picture being painted for rural North Carolina, and these numbers are pretty tough. So wanted to share this with you, and if you have any questions, follow up with us at the North Carolina Justice Center and the Health Advocacy Project.